HIV and SARS-CoV-2 are completely different viruses. They spread and make people sick in completely different ways. But in 2020, when COVID-19 started to spread, Stephanie Brooks-Wiggins says, it felt familiar. Everywhere you went, people just seemed to be getting sick, she says. Through the pandemic, she lost 5 family members to COVID-19. I lost my son-in-law. I lost my mother-in-law, my brother-in-law, my sister-in-law. They all died within months of each other. Back in 1986, when she was diagnosed with HIV, it felt the same way. There were people dropping like flies, people were dying, she says. What's also familiar to Brooks-Wiggins is the optimistic refrain from federal officials: as scientific breakthroughs give society more ways to combat the spread of the virus, we have the tools. There are now effective COVID-19 vaccines and treatments, tests you can do at home in minutes, and high quality. 3 years ago, under a different administration talking about a different virus, the message was exactly the same. We have the tools available to end the HIV epidemic, then Health Secretary Azar wrote in 2019 announcing the End the HIV Epidemic initiative. There are at-home HIV tests, a pill you can take daily to prevent HIV, and effective, easy-to-take treatments. Despite all those tools, decades after it started, the HIV epidemic has not ended in the US. An estimated 1 in 4 people who might be eligible for the preventive pill actually take it. Around 150,000 people in the US are HIV positive but don't know it because they haven't been tested. And more than 30,000 people in the US test positive for HIV every year, a number that has remained stubbornly high, even as new tools have been developed. When federal officials say we have the tools, Brooks-Wiggins says, they're missing the point. There's a human aspect to it that they're discounting. People have emotional habits that they don't break, and that's how the virus thrives, she says. As with HIV, the COVID-19 situation is still precarious even though effective treatments are available. Cases skyrocketed in the winter despite widely available vaccines.